হ্যালো স্টুডেন্টস, ওয়েলকাম টু অল অ্যাবাউট নার্সিং চ্যানেল। সো আজকে এই ভিডিওটিতে আমরা আলোচনা করব প্যানক্রিয়াটাইটিস নিয়ে। তো বাই দ্য পিকচার ইউ ক্যান আন্ডারস্ট্যান্ড দ্য difference between two pancreas. So this is the healthy pancreas you can see, and this is the inflamed pancreas. So by the picture you can clearly understand the difference between two pancreas. So this is the pancreatitis or the inflamed pancreas. So definition. So what is pancreatitis? So basically pancreatitis is the inflammation of the pancreas. It happens when digestive enzymes start digesting the pancreas itself. So basically what happens? So in pancreatitis, so there is the inflammation of the pancreas. So why the inflammation is occur? So কেন আমরা inflammation দেখতে পাচ্ছি? Because the digestive enzyme which is secreted from the pancreas, so those enzyme digest or those enzyme damage the pancreatic wall itself, means the autodigestion. So কি বলতে চাইছে না, প্যানক্রিয়াটাইটিস হচ্ছে একটা ইনফ্লামেশন অফ দ্য প্যানক্রিয়াস, যেখানে কি হচ্ছে না, প্যানক্রিয়াস থেকে যে এনজাইমগুলো সিক্রেট হয় সেই এনজাইমগুলোই প্যানক্রিয়াসের ওয়াল বা প্যানক্রিয়াসের যে লেয়ারগুলো রয়েছে সেই লেয়ারগুলোকে নিজের এনজাইম নিজেই ডাইজেশন করতে থাকে বা ড্যামেজ করতে থাকে। সো তার জন্য কি দেখা যায়, ইনফ্লামেশন হয়। সো দিস কন্ডিশন ইজ কল্ড প্যানক্রিয়াটাইটিস। সো দিস ইজ টু টাইপস, অ্যাকিউট অ্যান্ড ক্রনিক. So behind pancreatitis, the anatomy of our digestive system of pancreas. So pancreas, we all know it is a J-shaped organ. So it is a J-shaped organ, and which is situated obliquely in the abdominal wall, and it is situated at the first and second lumbar vertebra region, and it is just below the our stomach. It is situated. So this pancreas has some part like head of the pancreas, this is the body of the pancreas, and this is the tail of the pancreas. And if you carefully look at the picture, that there is a pancreatic duct. So the function of this duct of this pancreas is, it basically helps to carry out all the enzymes which is secreted from the pancreas. It carry out the enzymes into the duodenum. So this pancreatic duct is connected with the common bile duct. This is the common bile duct. This green colored duct is common bile duct. So pancreatic duct is connected with the common bile duct before it evacuate into the duodenum. So basically this pancreatic ducter ফাংশনটাই হচ্ছে প্যানক্রিয়াস থেকে যে এনজাইমগুলো সিক্রেট হচ্ছে সেটাকে ক্যারি আউট করে, সেটাকে নিয়ে গল ব্লাডারে যে আমাদের কমন বাইল ডাক্ট রয়েছে সেই কমন বাইল ডাক্টের সাথে অ্যাটাচ হয়ে এটা ডুওডেনামে গিয়ে ওপেন হচ্ছে, যার ফলে কী হচ্ছে না, ডুওডেনামে গিয়ে প্যানক্রিয়াটিক এনজাইম ইভাকুয়েট হচ্ছে। সো প্যানক্রিয়াটিক এনজাইম লাইক প্রোটিয়েজ, অ্যামাইলেজ, লাইপেজ, সো দোজ এনজাইমস, ফাংশন অফ those enzymes are to break down the fat, protein and the carbohydrate. Amylase basically it breaks the carbohydrate, the protease basically breaks the protein, and the lipase breaks down the fat. So this is the anatomy of pancreas. So next move to the types of pancreatitis. So basically I previously told there are two types, acute and chronic. So acute pancreatitis is inflammation of the pancreas that occurs suddenly and usually resolves in a few days. So acute, by the term you can understand, it is sudden onset, can be treated within a few days, and it is a reversible condition. Means the pancreas became in normal condition if the treatment is doing treatment is doing in their best and in time. So then the pancreas became in normal function. So the chronic pancreatitis is opposite. It is a continuous, prolonged, and it is an inflammatory process, and in which the pancreas became fibrosed or became calcified. Means in chronic pancreatitis, when the acute pancreatitis occurs in suddenly or gradually, in a few days interval, acute pancreatitis or pancreatitis, a patient is suffering from pancreatitis in a prolonged period of time. Means after some month or some year, patient is suffering from pancreatitis. After then there is the relapsing of the case. So in that case, the prolongation of the pancreatitis, so that condition is called chronic pancreatitis. But in the chronic pancreatitis, the cells or the tissues of the pancreas become fibrosed. means calcified. So in that condition, pancreas cannot be reversed back to the normal condition. So that is the chronic pancreatitis. So next to the causes of acute pancreatitis. So there is a main causes of acute pancreatitis, that is gallstone. If the patient has any cholelithiasis or gallstone, so that can lead to acute pancreatitis. Because if the gallstone, if the gallstone, so gallstone means, here the gallstone means the gallbladder stone. So stone can slip out into the common bile duct. So if the gallstone block the common bile duct, so what happens, the pancreatic juice or pancreatic enzyme which is carried out through the pancreatic duct into the gallbladder, into the common bile duct. So if the stone block the common bile duct, so what happens, the pancreatic enzyme became occluded. Pancreatic enzyme cannot goes to the duodenum. So pancreatic enzyme stays in the pancreatic duct or in the pancreas. So when the pancreatic enzyme stays long in the pancreas, so the pancreatic enzyme started to digest its own cells and tissues. So that causes pancreatitis. Other than that, alcohol. So if the person is taking alcohol or in ethanol, so alcohol provokes and it irritates the pancreas, and that's why it stimulates the inflammatory response to the pancreas and creates inflammation in the pancreas. So next is trauma, like if the patient is undergoing in ERCP or any endoscopy. So after ERCP, if they due to the procedure, if it can be, there is a chance to damage to the pancreas by the ERCP or the endoscopic tube or catheter, so or the instrument. So that's why there can be a chance of injury to the pancreas. So from there, pancreatitis can occur. Other than that, the steroid medicine has a side effect and to develop pancreatitis. Autoimmune, if the person has autoimmune disease, means his or her own immune system destroy or damage his or her own cells, healthy cells and tissues. So that condition can cause pancreatitis. Other than that, the scorpion bites or spider bites, means any spider bite, after any insect or spider bite. So spider or the scorpion has the toxins in their stings, and those toxins actually harmful for the pancreas, and toxins causes pancreatitis or inflammation of the pancreas. So next, move to the clinical manifestation of the acute pancreatitis. So basically, first manifestation is pain is felt in the upper left side of the abdomen. So the best or the most common symptoms is pain in the upper left side of the abdomen, and a swollen and tender abdomen is seen. Nausea and vomiting can be seen. Fever, paralytic ileus can be seen, because there is less metabolism, because I already told that from the pancreas, the amylase, protease, lipase, this kind of enzyme is secreted from the pancreas. So if there is lack of the enzyme from the pancreas, so what happens, the carbohydrate, protein, fat, those our macronutrients are not be metabolized or are not digested due to the lack of enzyme from the pancreas. So that leads to stasis of our food particle of the there is lack of metabolism of our macronutrients. So that leads to lack of movement of our digestive system, means the our bowel movement is less. So that leads to paralysis or paralytic ileus. So diagnostic test which can be done for pancreatitis, acute pancreatitis. So we all know that every disease condition, the first test or first our work is to collect history properly. So we have to collect history, like the alcohol, if the patient is getting or taking alcohol or ethanol group of drinks, or the patient has the history of gallbladder stone, or the family history is there or not, or if there is any history of spider or scorpion bite. So those kind of history which I already told in the causes. So cause should be identified by the history taking. And physical examination, by the physical examination we can assess the abdominal pain, in which area of the abdomen the patient is feeling pain. So that site should be assessed properly. And along with that, the symptoms which I previously told, that paralytic ileus, the bowel sound should be checked, the the vomiting and the patient's fever, so that should be checked through physical examination. So after that, the laboratory test like serum amylase, serum lipase, triglycerides, calcium should be checked. So serum amylase and serum lipase, if we investigate the patient's serum, so there is a elevated level of amylase and lipase in the serum, because the pancreatic enzyme amylase lipase is staying in the pancreas, so in the body. So that's why there is increase in the amylase and lipase. And triglycerides, the level of triglyceride became increased in the serum, but the calcium level should be decreased. If we check the value of a pancreatitis patient lab value, so there should be decrease or decline in calcium value, because due to pancreatitis, due to lack of enzyme of pancreatic enzyme in the duodenum or intestine, so that leads to lack of absorption of calcium in the intestine. So mainly calcium is absorbed in the intestine. So due to the lack of enzyme from the pancreas, so that leads to lack of absorption of the calcium, so that leads to lack of calcium level in the serum. Other than that, we have to check the blood glucose, because we all know that pancreas helps to regulate our insulin secretion from the pancreas, the islets of Langerhans, and from that, from the beta cell, the insulin is secreted. So if the pancreatitis is occur, inflammation of the pancreas, due to the inflammation of the pancreas from the beta cell, the insulin secretion became hampered, so that leads to there is glucose secretion, the blood glucose level became fluctuate. Diabetes mellitus can be seen. So lack of insulin secretion is seen in pancreatitis patient. So if there is lack of insulin secretion, so there is increased blood sugar level in the blood, means diabetes mellitus can be seen. And abdominal ultrasound, endoscopic ultrasound, and contrast CT scan. So all the imaging study is done to identify the underlying cause of pancreatitis. And other than that, ERCP, we can do ERCP, endoscopy retrograde cholangiopancreatography. By that we can identify the we can visualize the pancreatic duct, cystic duct, and common bile duct, and through which we can identify the root cause of pancreatitis. So next come to the management, the medical management. So I already told that main symptoms is pain, so you have to reduce the pain. So by administering morphine, which is a opioid analgesic, so by which we can reduce the pain of the patient. Other than that, nothing per oral, or patient should be in NPN status, because there is a tendency of vomiting, and there is a paralytic ileus, so that's why patient should be kept in NPO. So and through the parenteral route, we can provide our nutrition like TPN, total parenteral nutrition, or we maintain the hydration of the patient by administering ringal lactate solution. And I already told that calcium level became decreased in pancreatitis patient, so we have to increase the calcium level in the blood. So that's why we can administer calcium gluconate, so which increase the calcium value to prevent tetany. So if there is decrease in calcium level, that can lead to tetany. That's why we have to administer calcium. Other than that, we can administer carbonic anhydrase inhibitor, which helps to release out all the pancreatic enzyme and juices by it acts as a diuretics. And antacids we can give, and proton pump inhibitor we can give to balance the extra acids in the gastric acids, and it neutralizes the gastric acids, and inhibit the further production of the gastric acid. And the surgical management, basically for the acute pancreatitis, so if the pancreatitis is due to the gallstone, so immediately by the endoscopy or by the laparoscopic, the gallstone should be removed. And other than that, the endoscopic sphincterectomy can be done. So by the endoscopic route, the sphincter of OD, the muscle which is situated at the common bile duct and the pancreatic duct, which is open into the duodenum. This is the duodenum. So where the common bile duct and the pancreatic duct is connected with the duodenum or open into the duodenum, there the sphincter of OD is present, the muscle. So sphincter of OD can be incised out, surgically removed, so that the occlusion or the pancreatic juice can be opened out into the duodenum. So sphincter of OD can be surgically removed, so that the pancreatic enzyme can be the flow can be maintained. So that is the endoscopic sphincterectomy. So those are the management of pancreatitis, acute pancreatitis.